deliver the message to me. Elbow bumps. Well, thank you for all turning and burning to get here on a moment's notice for this important, not just announcement, but the sharing of some important details as we all go forward. We're here today to announce that Indiana has, in fact, received its first case of coronavirus COVID-19. Our state health commissioner, Dr. Box, and the other medical professionals that you see here will be discussing the specifics of the case and our response, those specifics that we can, in fact, share. But I did want to also stress and underscore how we are moving forward. I have just signed and declared a public health emergency to ensure that the state of Indiana is in the absolute best position to get the federal funding necessary to respond step by step. Again, as we have all said since January, since the outset of this, and today just serves as yet another reminder of the importance to stay informed and prepared as you carry on with your daily lives. So with that, I'd like to ask the Commissioner of Indiana's Department of Health, Dr. Chris Box, to share some of those details that we are able to and some of the steps that you'll see unfolding as the days ahead move on. Thank you.
Thank you, Governor. Good morning, and thank you for coming on such short notice today. We're here today to announce the first presumptive positive case of COVID-19 in the state of Indiana. The patient is an adult who recently traveled to Boston and had contact with individuals at an event last week where positive cases have been identified. This individual is currently in isolation, and there is no ongoing risk to the public. With the global spread of COVID-19, the question has never been if Indiana would get a case, but when we would see one. We have been preparing for this possibility, and I want to stress that this is an isolated case at this time. I also want to commend this patient, Community Hospital North, and the Marion County Public Health Department for their swift actions in this matter. The patient and the hospital did everything possible to limit the risk of exposure to other individuals. Because of those steps, the risk of additional exposure and community transmission was decreased, and we're taking every precaution to prevent new infections related to this patient. I encourage Hoosiers to continue to educate themselves about COVID-19 and take steps to protect themselves from this and other respiratory illnesses by covering their coughs, washing their hands thoroughly, not shaking hands, but doing the elbow bump, avoiding touching their faces, and staying home if you're sick. The situation with COVID-19 is changing rapidly, and we can expect to see other cases in Indiana in the future. As this case demonstrates, we are prepared for that possibility, and we will deploy all steps needed quickly to protect Hoosiers. We have spoken with the governor, as you can see this morning, and he has declared the public health emergency. This will help to not only alert Hoosiers to be on heightened awareness for this, but as the governor says, will allow us to make sure we have access to the resources that we need. Also, Dr. Kane from the Marion County Health Department would like to make a few comments, and then Dr. Yaletti and Dr. Ledyard from Community Hospital North will walk us through how this was managed at the hospital.
Thank you, Christina. Governor. For the past month, the Marion County Public Health Department and the Indiana State Department of Health a week since late January. So today's announcement that confirms this first case might cause some additional concern among residents and people who work here, but we have to emphasize again that we are well prepared. We've been waiting for this situation, and because this is just one case, we're going to continue to just have the public do the things they need to do in order to protect themselves. Now, the Marion County Public Health Department and the Indiana State Department of Health will continue to work together in the contact investigation and the monitoring of this patient. And we're going to make appropriate recommendations to anyone we feel might be at high risk for contracting this COVID-19. And although this doesn't change the guidance for steps that each of us can take to reduce the possibility of spreading respiratory viruses such as COVID or even the flu, and I just want to reiterate what Christina is saying, that stay home if you're sick, except to get medical care. But I want to say, when you seek that care first from your provider or your physician's office or in even an emergency room, please call ahead first. We do not want an individual contaminating anybody in a waiting room area. So let us take the necessary steps we need to do to protect anybody while you are seeking medical care. So please let us know. And I'm going to also say, guys, we don't even want you shaking hands. We don't want you hugging anybody. And we do want you to know how to learn the Indy bump when you're greeting other people. And so just know that you have to wash your hands frequently and are using alcohol-based hand sanitizer. And it has to have at least 60% or higher alcohol content in order to be effective, and clean frequently and disinfect all surfaces that you come into contact. We have an opportunity to keep our community healthy and safe, and we have incredible, and when I tell you we have incredible healthcare professionals here, hospital systems who know how to do the right thing. We're very fortunate to be in the state of Indiana and in this community. And just want to thank again all the expertise that the Indiana State Department of Health has brought to the state of Indiana, and her collaboration with all health care officials, all local health department officials in the state of Indiana. Reminder, we're well prepared. Thank you.
Thanks, Governor, Chris, and Jenny. Good morning. My name is Ram Yuleti. I'm the Chief Physician Executive for Community Health Network. Just want to briefly explain the events that occurred last night and why we feel comfortable at this time. So there was an individual that had called the State Department of Health last night stating they're concerned that they may be positive. The State Department of Health asked that individual to go to Community North Emergency Room for testing. Prior to him arriving, the Community North Hospital Emergency Room Department was notified he will be coming. Once he came, he stayed only in the parking lot. At that time, our caregivers, dressed in the appropriate infectious disease precaution material, received him. He was then placed in the appropriate material as well as a mask and other appropriate infectious disease precautions. He was taken back to an isolation room through a different side entrance, not in contact with any other individuals. He was placed in a room that has negative airflow, and then the appropriate testing was done. After that was completed, he was then transported back to the self-quarantine where he previously was located. I want to reassure you that no patients, no other caregivers were exposed to this individual. We're exceedingly cautious on the route he took, and minimal to zero exposure to anybody that did not have protective infectious disease material. Because of that, I want to state, especially for the patients that are at any hospitals today, that they should still feel comfortable that their loved ones are safe. There's no risk of them getting infected right now, and we would reassure that all patients at this time, we do not see any evidence for any spread of this. Thanks very much actually to the prompt response of the State Department of Health notifying us, and so that we could take the appropriate precautions. I do want to also underscore what Jenny was saying, is that all of us, all healthcare professionals, have been planning for some time. Again, as she noted, it was a matter of when, not if. With that, we feel very comfortable. We have everything prepared to do the best we can to handle these situations. The most important thing I would re-stress what Jenny was saying is not to panic. It's also very important to understand that wearing a face mask is not going to reduce your risk of infection. Face masks are for people who we consider may be potentially infected. General people, population like ourselves, will not benefit from face masks. The most important thing you can do is very frequent hand washing and minimize touching your face. But face masks there's a limited supply, so I don't want people trying to rush out finding those. Those are meant for the patients who possibly be infected. Again, I want to reassure you that the hospital is doing everything they should, and the risk to patients right now is minimal. I'd like to introduce my colleague, Dr. Robin Ledger, the Chief Medical Officer for Community Health Network as well.
Thanks, Ram. Thanks, Jenny. Thanks, Chris, and thanks, Governor. I just want to stress and close with saying that, as Dr. Yaletti said, we feel that Community Hospital North is in good hands. We have not infected any caregivers. What I'm going to close with is reminding the public that these are the symptoms that we want you to look for, to think about if you feel you've been exposed to COVID-19. If you feel you've been exposed to COVID-19 and you have a fever, a cough, and/or shortness of breath, then as Dr. Kane said, please call. Please call to either your primary care provider, your local network, Marion County Health Department, State Department of Health. You will be appropriately triaged for whether or not you need to come in to be tested. It's so important right now that we as a public band together to make sure that we support each other, treat each other, but also understand the nuances with COVID-19. The team at Community North was textbook in their treatment of this person, but it was because they were called ahead, warned that this person was coming, and they could meet them, and again, as Dr. Yaletti said, transport them through an area without undue public exposure. So we have to get the message out from a public health perspective of how we treat this disease, not where you just rush into a site of care, but call. If you are concerned that you've been exposed and you have the associated symptoms, please call first. And again, we can't say it enough, keep washing your hands, don't hug right now, and let's take care of each other. So thank you very much.
We'll be happy to take some questions, myself or Dr. Kane. Yes.
Can you talk a little bit more about the symptoms this person had and how you tested this person for COVID?
Certainly, this individual had developed some very mild symptoms, actually. I think a sore throat, low-grade temperature, 100-point something, and the individual also was developing a little bit of a cough, and realized, because he had received information from the individual's work, that there may have been an exposure, was watching for those symptoms. And the tests are basically 3 types of tests we do: a nasal pharyngeal swab, where we put it into the nasal area, into the oral pharyngeal area, and then if we can get sputum where someone coughs deeply and coughs something up, then that is a really good specimen also.
Dr. Box, where is the patient from and how old is he?
The individual is a Marion County resident, and it's an adult.
Age range?
Not in our highest risk category.
Gender?
We usually don't give that information out.
You referred to him as he.
Yes, I did.
Is this individual currently hospitalized? Is he at home?
No, this individual is in isolation outside of the hospital.
And this individual's condition?
Stable.
How long is the person in the hospital?
Just that amount of time that required to be evaluated.
From 11:37 to about 2:30 a.m.
Are you asking any other individuals who've had contact with this individual to social distance, or what about the folks at work? Didn't go to work?
So those are things that are currently being investigated right now. So as we do this individual's evaluation, Marion County Health Department will be taking the lead on that, and those are the questions. You know, what flight did you fly in on is very important. Where were you staying? Who did you have contact with? Did you go to school? Are there children or other individuals in the home that could have been exposed? And those are the things that Marion County Health Department will be following up on very closely.
Was the patient in Boston on business or conference or there for personal reasons?
Was associated with a conference out there. Did not go to the conference, but is a contractor that works closely.
How long was he in Indiana for after his trip to Boston?
Individual returned to Indianapolis on the 4th, Wednesday the 4th.
Did he expose any of his family members?
That is still being under investigation at this point in time.
Even
So we at the State Department of Health have tested a total of 12 individuals at this time, and we are monitoring about 35 individuals. But they are all quarantined. They are none of them sick. The only positive test we've had is the one we are telling you about today.
Who does the patient work for?
I don't normally give out that kind of private information about an individual.
Is he at home right now or still in the hospital?
Not in the hospital, but under isolation. He is just in self-isolation at this point in time.
You said you tested 12. Is that total, or is that 12 in relationship to this specific
No, this 12 total so far.
since the beginning of January or whatever? Yeah.
Well, and some that the CDC did for us also. But we have had the testing ability since Saturday, this past Saturday.
The president signed an $8 billion COVID-19 aid package. What does the state want? What do you need from the federal government at this point? What does Indiana need?
So we are going to need additional, what we call epidemiologists, to be able to go out and to investigate these cases and to follow up and trace contacts with this. We will need more masks for individuals that are isolating at home. We will need to be able to have the ability to follow them up and to do lab testing to confirm that they are now free of the virus before they can stop being under isolation. We need resources with regards to a call center, because our call center is very, very busy right now taking questions, not only from providers across the state, but also just from kind of the worried Hoosiers across the state that want to ask questions. So we're going to try to split that up a little bit and divide and conquer. Jenny will need some resources for our local health departments. Are there other
So
things?
we may need costs for like when you're quarantining someone and you have to isolate them, paying that financial cost that's associated with that. And we'll have to have a lot of outreach, and we have to have daily monitoring of individuals that we are monitoring. Daily contact, sorry.
To be clear, the patient is not in the hospital right now.
That is correct. As I said, 80 to 85% of these cases are mild cases. So many people do not get hospitalized with this.
How would you classify this case?
As a mild case at this point in time. There is nothing that indicated this individual needed to be hospitalized.
What is your biggest concern? We don't like to use the word fear. But you go to bed at night, you have a moment to think. What is your biggest concern at this point?
Well, I think that we have seen that the majority of deaths in the United States have occurred because there was a long-term care facility that got the COVID-19 infection, and that is our highest risk individuals. They're usually individuals that are quite elderly, over 65, and individuals that have underlying health conditions. So the messaging out there should be, if you are ill, if you are at high risk, if you've been exposed to COVID-19, if you have been in any of these countries or even states that have a high percentage of cases, I would not recommend visiting the long-term care facilities right now. And we're getting that messaging out there to all the long-term care facilities.
As far as you know, is the patient on any special medications?
No, this individual is actually pretty healthy, so we're blessed for that.
This is Dr. Kane, a follow-up question. I'm sure that folks will be concerned when they hear that there's a person in our community. Are you planning to do a follow-up today to let folks know, whether there'll be any, what is sort of your time frame of getting the word out about potential contacts of this one?
So we're hoping that because all of you guys are here and we have such great attention from the media, that this initial message will be really critical to getting out to the public. But this case is fluid, so based on any new additional information that comes out, we will dictate further information coming out related to that. So I can't tell you now. I'm going to do a press conference this afternoon further than from this.
But what I'm asking is, we're being told that testing is being done priority for folks who've had contact with someone.
Yes, so as
But I have no way of knowing at this point.
so just remember, he was in that emergency room at that hospital at 2:00 in the morning, and they called their folks from home to do the laboratory tests for this coronavirus, so we had an answer this morning related to that. So we're going to do our investigation, and if we have any additional cases, we will definitely continue to be transparent and release that information. Okay. But hey, my biggest concern, I need the public to be patriotic and do the things they need to do to protect themselves. And I want them to take this virus very seriously, but you can die just as well from the flu, influenza. So we want people to do the practice things that they need to do to protect everyone, and please follow our guidance.
Dr. Ulet, you talked about you taking steps, you've done advanced planning for and events of this kind. Can you just elaborate a little bit more on the planning you've done and how long ago that started and what it involved?
So all hospitals have disaster plans. So we've had for many years an infectious disease code internal disaster plan. We've activated before when we had Ebola back in 2014. And so there's emergency preparedness for all kinds of scenarios, whether it be one individual, multiple individuals, multiple sites, ambulatory sites, ED. So we've opened that up and we refreshed that. And so we have about a staff of 25 to 30 people that meet on a daily basis and have been for a number of days to address all the different scenarios for potential. So are we covering every single possible scenario? Probably not, but that's the reason we meet regularly and we have had these plans in place. All citywide hospitals do this on a regular basis.
And they have to practice it at least minimum once a year, where they do an actual practice based on a scenario that they think. So it's just not we're prepared, we actually practice.
But how much, you talk about an isolation room, how much capacity do you have for isolation space for additional cases?
So that's why we need to be judicious. All of our emergency rooms and all our hospitals have these isolation rooms, these negative airflow rooms. We have several at every institution. At some point, we may reach a capacity, so we actually are doing disaster planning where we may need to isolate specific wings of a hospital or do other potential ways of increasing capacity. Right now, we have ample isolation, but if it indeed becomes significant, we have disaster plans in place, again, for different wings or other options at all the hospital sites. And again, I want to reiterate that every hospital has these same contingency plans. Will we ever be completely prepared? Probably not, but we're trying to stay several steps ahead of the game.
Hi, thank you all so much for coming. We're going to cut this off now, but we will have a release from the State Health Department coming out shortly. Thanks so much.